devoted his congressional life to health care for all Americans. 2 minutes for Mr. Kennedy.
The gentleman is recognized for 2 minutes.
Notwithstanding this point of order, I urge passage of the underlying rule and for us to go forward with the health insurance on behalf of the 21% of my state's constituents under the age of 65 who are uninsured because they're either too young to qualify for Medicare or they're too middle class to qualify for Medicaid. Quote, no memorial, oration, or eulogy could more eloquently honor his memory than the earliest possible passage of this bill, for which he fought so long. His heart and his soul are in this bill. While the above quote could easily refer to my father, and the context could easily describe this health care debate, these words were in fact spoken by my father as he rose on the Senate floor to honor his brother, President Kennedy, during the debate on the 1964 Civil Rights Act. The parallels between the struggle for civil rights and the fight to make quality, affordable health care accessible to all Americans are significant. It was Dr. Martin Luther King Jr. who said, of all forms of inequality, injustice in health care is the most shocking and inhumane. Health care is not only a civil right, it's a moral issue. Thank you, Madam Speaker, for your political and moral leadership for helping those to secure more advanced protections and benefits, especially in the area of mental health and addiction. Thank you, President Obama, for delivering on your promise of providing the politics of hope rather than the politics of fear. And I yield back the balance of my time.
The gentleman from Wisconsin. Gentlelady from New York.
Mr. Speaker, I yield 2 minutes to the gentleman from Vermont, Mr. Welch.
The gentleman from Vermont is recognized for 2 minutes.
Mr. Speaker, this debate has been long, but it's now complete. And the arguments have been very contentious, but it's now time to decide. And the bill before us is long.